Hello, Best Self community. It's Dr. Saluja of Dermatology Post-Plastic Surgery for Your Best Self, and I'm with Kristen, Roff, nurse practitioner, and today we're talking about vaginal laser rejuvenation. Welcome, Kristen.
Thank you.
I'm going to just start asking you questions.
Okay.
What does laser vaginal rejuvenation help with?
Vaginal dryness, itching, burning, urinary incontinence, and then painful intercourse.
And how many treatments does someone get, to see benefit?
Usually, benefit starts after the first treatment, within days after. But most people do a series of 3, separated by about a month, and then they can do one every 6 months after that, or whenever they want.
Is there any recovery or is there any pain?
No recovery, no pain, no downtime.
What's a treatment like?
It lasts about 5 minutes, and if you've ever had a transvaginal ultrasound, that's kind of what it's like. The probe is inserted, and then there's a laser on the tip, and we move that laser around to 6 different points, and in doing that, it covers the whole vaginal canal, just moving on down through. Like I said, like 5 minutes.
And it's more than a temporary effect, correct?
Yes,
there's
it's
actual
a lasting
change.
effect. Yes, there's a change in the tissue.
How does the laser work?
So it penetrates into the subdermal layer, and it introduces heat, which stimulates collagen and the vaginal tissues to regenerate.
Remind me when I'd see results again?
After that first session, you'd see it within probably a week, most people say. Yeah.
Okay. What's the cost per treatment?
$900 a treatment.
And why would someone choose vaginal laser rejuvenation over surgery or prescriptions, or can they do it in conjunction with prescriptions?
Yeah, you can do it in conjunction with prescriptions. It's not systemic, right? So it just works locally, which is nice. So there's no real side effects that come with it. And then the cost is obviously it's much cheaper than surgery, and you don't have to go under anesthesia. So no downtime, cost.
It's a very safe procedure.
It's very safe.
What's your typical patient?
Someone who's had children a lot of the times, or older, with or without children.
Premenopausal, postmenopausal, or both?
Both.
Okay. And who can't have vaginal laser rejuvenation?
So anyone with a vaginal or cervical lesion that hasn't been fully diagnosed or treated, anyone with active infection in the area, pregnancy, or you have to be at least 3 months postpartum to have the treatment, and then any history of radiation to the vaginal or rectal area is contraindicated.
Okay. Anything you'd like to add?
They're just really quick and easy, and I would say I have a lot of lasting effects from it from my patients, so I recommend it to anyone who has any sort of vaginal dryness, itching, burning that's not otherwise diagnosed.
Yeah, the patients that I've seen are super ecstatic and very pleased after treatment because it surpassed their expectations. And, we love it when there's treatments that are safe, not painful, no downtime, and it exceeds expectations.
Yeah.
So
it's a winner.
It's one of the treatments that it's just hard to talk about because there's so many other things we're talking about in the course of a skin exam or an aesthetic visit or a plastic surgery consultation. And so we wanted to get the information about vaginal laser rejuvenation out there because I think those symptoms are very, very common and under talked about.
Agreed.
Call us at 321-241-1160 for a consultation with Kristen, or visit us at foryourbestself.com or email us at info@foryourbestself.com. We'd love to hear from you, any further questions you have, and we'd love to see you to help you be your best self. Thanks for listening.